I have all this information. It's like, people need to know.
Thank you for taking time to come to a second podcast. This is the second time you've been with me, and I'm so happy. And you came to a focus group I had too.
I did.
Really happy. Oh, you've really had my back. Now I want to have a chance to have yours.
Oh, thank you. I really appreciate you being here.
Let's start off with background and inspiration into how you got started. Okay. Can you tell us about your journey in medicine and what led you to specialize in emergency medicine initially?
Well, my father is a physician, so I was always inspired by him. And, took a little bit of a meandering path, but I always wanted to, be of service to other people and to help other people. So that led me to medicine. What led me to emergency medicine? Well, in medical school and residency, we have the opportunity to do all sorts of different types of fields, to experience different fields. And, I really thought I would be a pediatrician or an obstetrician gynecologist. But the thing that really drew me was being in the emergency room. So being in the ER was just so much fun. It was fascinating. Fun may not be the right word for it, but you never know what to expect. You see people from all walks of life. You see all different things. So every single day was different. And I really felt the immediacy of being able to help somebody right then and there. Someone comes in with a broken bone, you just patch them up, you fix them up. And that was really gratifying to me.
What I understand is that a lot of people, because of their income situation, use ER as their regular hospital. Did you see more of that or less?
I
what was
did.
Like?
I think that's part of the problem with the medical system in the United States. A lot of people don't have health insurance. A lot of people don't have a family doctor that they go to. And so they do use the emergency room sort of as their primary care, which is not what it's built for. That's why people come in with serious emergencies and end up waiting hours and hours to be seen, right? Because you have to see, all the overflow and all the people who come in through your doors. You cannot, in the American emergency room, refuse anybody. Right? If you want to be seen, you have the right to be seen.
And they keep it in the order unless it's life or death.
We triage it. Yeah, we try and do triage so that the people who need to be seen immediately get seen first. Right? But it does put a strain on the system.
Okay. What specific experiences or cases in the United States prompted you to shift your focus towards lifestyle medicine?
Okay. So, I loved ER, right? I just loved it, loved seeing different things every day. But I did notice after a while that, again, like you said, the people who were using it as their primary care, they would come week after week for the same thing. Right, someone who had asthma, we call them frequent flyers because they were always in the emergency room. And it was kind of like a revolving door. And I felt like we're not helping these people really. We're putting a Band-Aid on something and then they just end up coming back. So I kind of felt like, it needs to start sooner, right? Not just putting the Band-Aid over the bleeding wound. And I realized after time that 80% of what came through the doors in the emergency room could have been prevented. Whether it was, heart disease or heart failure or asthma or even certain types of infections, even cancer, right? 30 to 40% of cancers are deemed to be preventable. So, after all this, I was thinking, there has to be a better way. Even though emergency medicine is something that's definitely needed, there's so much that we can do to take care of our bodies and our health before we get to that point of needing the emergency so often. And again, pharmaceutical companies, they do a very vital role in our society and medicine. Without their inventions and innovations, we wouldn't be able to treat so many of these illnesses. They do have a huge overhead and cost, and just the way medicine's been built up over the years, obviously the people who are in charge and the people who are making money off of the medical system as it is today, they're not going to want to easily give it up.
That's
so,
right.
And things like lifestyle medicine, the prescribing, eating more broccoli is not going to be making anybody any money, right? But it would be, better for the health of the general population. So.
That's so true. That's so true. Okay, let's get into understanding lifestyle medicine. Okay, how would you define lifestyle medicine, and what are the core principles?
Okay, so the core principles of lifestyle medicine. Lifestyle medicine is actually a recognized subset of medicine, and it really is using the evidence-based medicine, right? Using not just the latest fads or anything, but using evidence to show what we can do to prevent and to actually maintain and to treat illnesses using the core foundations of lifestyle, which are avoiding toxic habits like tobacco and over drinking, being able to nourish your body, so a good healthy diet, exercise, movement, and sleep, which is extremely important, and also like relaxation and being able to connect to other human beings. And these are all things that have been shown, with research and data to be really, really foundational to having good health.
All right, can you share some success stories and cases where lifestyle medicine made a significant difference in patients' outcomes?
Oh yeah, absolutely. I mean, we all know, right, that, if you quit smoking, that your risk of getting heart disease or lung cancer, truly diminishes, or changing your diet, can have huge benefits. We all know what we need to do, but the problem is it's hard, right?
Don't you? I think we're being tricked so often, whereas, let's say the food company or the food industry has spent so much money and research on how we taste food and what tastes good,
right,
regardless of its nutritional value, that once you eat it,
right,
I think that someone told me it's just basically sugar and salt.
Sugar, salt, and fat.
Sugar, salt, and fat. And those are something we crave.
Yeah.
And if you can get the right taste for that, you can pretty much manipulate anyone's dietary habits.
That's right. There's a whole industry around it. They actually have food scientists to find out what textures and what tastes are highly addicting. So they actually, craft a food that is, or I should say a food-like product. It's not really food, right? They're designing something that's addicting, that you will go back for, and and the way marketing is done too, right? They say, bet you can't just eat one, right?
I was thinking the same commercial. We won't name the company, but I bet you can't just eat one. And it was so true, and you went out to get it just to see.
Right.
And you didn't eat just one, you finished that whole, the whole product.
Right, so food is now not something to nourish your bodies necessarily, but it's for industry and marketing and for long life. Basically, all processed foods were built so that it can have a long shelf life, which is
good for the producer,
shelf life, right?
Right, for the shelf life, but it doesn't do anything because your body can't process that, right?
Exactly.
And it doesn't even know what it is. Am I correct with that?
So, I mean, to make something last and that you can put in a box and that can sit on your shelf for years, right? In order to do that, real food, you can't do that. Right, so they have to take out a lot of the nutrition, the nutritional value that's in it. They also take out fiber from it, and fiber is really important. Fiber, even though it's not a macronutrient, it doesn't feed us. It helps to feed our gut bacteria, right? And we're finding out more and more our gut microbiome is so important for our immune system, for even our mental health. I mean, for our entire well-being. Sort of, we have more gut bacteria DNA in our bodies than we have our own human DNA. So it's like, who's the host and who's the parasite, right?
I heard that before. I think it was in some documentary I watched. You're taking me into the next area, which is preventable diseases. Okay, you mentioned that nearly 70% of illnesses you saw were associated with preventable lifestyle choices. Can you elaborate on the most common lifestyle factors contributing to these illnesses?
Well, there's so many, right? If you think of the top 3 illnesses that we are facing in modern society today, it's cardiovascular disease, heart disease and strokes, and things like diabetes. which also lead to other illnesses. It increases your risk factors for heart disease and also cancer, right? So those are probably the top three that we're faced with every day. And all three of those things are highly preventable, not 100% obviously, but by better nutrition, reducing stress. Your blood pressure goes up when you're stressed out, right? And if you're stressed out a lot for a long period of time, you end up with high blood pressure, right? If you think of the word hypertension, right? Hypertension. It's like when your tension is up, your blood pressure goes up, your stress hormones go up, and it affects all of your bodily functions. So, all of these things can potentially be reduced.
Okay, what role do diet, physical activity play in preventing chronic diseases like obesity, diabetes, and heart disease?
All of these are highly preventable, like not 100%, like you said, especially obesity. It's kind of a loaded condition, right? Because people think that it is, preventable, that it has to do with a person doesn't have enough self-control, that they overeat. It's very complex, right? Because there are genes, there are obesity genes that people have, and there are people who just naturally tend toward being thin or naturally tend towards being heavier. All of these things, lifestyle does play a role in. Obviously, you can have two identical twins and one be heavier than the other. You can have two identical twins, one get cancer and one not. All of those things, not just genetics, it is your environment. They say that even more than your genes, something that can affect whether or not you end up having obesity is your environment and who you hang out with, your friends. If you hang out with friends that just sit on the couch playing video games all day and snacking on chips, you're more likely to be heavy than having a group of friends that are runners and you go out and are active every day. That's actually something that's more influential than your genes. It's like your environment.
What inspired you to become certified master health and wellness coach?
I think it was part of that frustration of being able to help people, but just for the short term and not necessarily for the long term. And when I moved back to Japan, I wasn't practicing clinically anymore. I was doing a lot of really exciting, innovative things in the cancer space and using immune cell therapy and doing these things, but I kind of missed that sort of one-on-one, that human touch, being able to help people. So I decided that I wanted to start coaching people because, I have a lot of this knowledge. I became certified in lifestyle medicine, and I feel like I have a lot to share. And I think that's why I'm out on social media so much, because I have all this information. It's like people need to know.
Right.
So
you're doing a great job, because they do. And it's never going to stop. It's like when someone gave me an example, people always ask me, how you become successful. And first of all, I want them to qualify what they call success, because it's different for different people. But I say I consider success to be equivalent to breathing. The last thing we're ever going to do is exhale, right? So you can call that failing. Because if you exhale and don't inhale within 3 minutes, you're no longer in this existence, right? You have 3 minutes to be able to take another breath in. So taking that breath in would be considered success. So isn't it a constant in and out?
Yeah.
Successful, possible failure. Successful, possible failure, right? And that's how I look at life. It's not something you do once, it's something you continue to do.
Right. And I think that's what we talk about, like with habits and who you hang out with and what you do in your day-to-day life. Anyone can go on a crash diet and maybe lose 10 pounds or something, but it's not going to stick. What's going to stick is incorporating this into your everyday life, like how you eat, how you sleep, how you move. I mean, these have to become habits in order for them to have long-term success. That's just how you live your life.
Can you describe health and wellness coaching program you created after returning to Japan, and how does it work, and what are the main components?
Coaching is very individual, right? And there are all sorts of different types of coaching, right? There's executive coaching and athletics coaching. And in a way, health coaching is just like that. Right? It's a little bit different than being a physician, because when you're a physician, you generally say, okay, I'm taking the driver's seat, you're in the passenger seat, and I'm going to drive you to better health. Just follow me and do what I say. But everybody's a human being, and people need to take agency over their own health in order to actually be successful. It's one thing that a doctor can just write you pills and treat the symptoms, but you're not going to be healthy from the inside out unless you take agency over your own health. So you have to be in the driver's seat. And the role of coach rather than doctor is to do just that, to give the patient or the client agency over their own health and just direct them. I'm your GPS. I will tell you where to go and what the evidence shows and to what is evidence, what is shown to give you the best chance of improving your heart health or your brain health or your overall physical health.
I find that to be something that isn't taught in school. To doctors or anyone in almost any field, basically, they're not really taught to give the people they're working with agency. They're taught to take them and try to carry them through the whole journey, which never works.
Right.
It doesn't work that way. Let's get into research and findings. Okay, your research focused on relationships between lifestyle and disease onsets, particularly in relationship with immune system and cancer. Okay, what are some of the most significant findings?
So I think we touched on the gut microbiome. It's fascinating, right? Because that really has something to do with our immune system. 70% of our immune cells live in the gut. So if you don't have a healthy gut, you're not going to have a healthy working immune system. So that's where lifestyle comes in. That's why what you eat is so vitally important. If you're eating nothing but junk, that's processed foods that have vitamins and minerals and the fiber stripped out of it, it's going to influence our gut microbiome, which is going to influence our immune system, right? And if you don't have a good working immune system, you have a much higher chance of getting cancer. We all, if you think about it, right, we're just a bunch of, we're trillions of cells, right? And each of our cells, they regenerate every day, right? The old ones die and get replaced by new ones. But mistakes happen, right? We can be influenced by UV radiation, and a mutation can happen, and a skin cell can turn cancerous, right? Whatever we eat, we could be eating some and inhaling carcinogens. Mistakes happen every day, and there's bad luck too. Just in the every day-to-day, cycling of our cells, sometimes you can have a replication error, and it's actually they've estimated that at least 5,000 errors occur in our DNA, in our epigenetic and genetic changes every single day.
How many days does it take before you're a brand new person?
Oh, that's a good one. I'd have to look that one up.
But that's the truth, because you're not the person you were. I think I forget, it was 100 and something days, I think, whatever. They said every cell in your body has changed. Has changed.
Right.
So you're never the same person after a certain period of time.
Yeah. Now I believe that.
That's interesting, yes.
So if you think about it, as our cells are changing, these mistakes happen every single day. We probably do have cancerous cells in our body every single day. Right? The reason why we don't all get cancer is because our immune system is there to recognize that, oh, that's an abnormal cell, I need to get rid of it. So if you don't have a good working immune system, then your risk for cancer just goes up that much.
You collect in other diseases.
Absolutely.
Let me see, the next question I had on here is, how do lifestyle changes impact the immune system and its ability to fight diseases, including cancer?
Yeah, so all of those things, right? When I always like to break it down, eat, sleep, move, and relax, right? What you eat certainly impacts your immune system. If you're eating nothing but processed foods, your risk of cancer goes up. I think with every 10% of processed foods that you increase in your diet, you have a 12% increase in getting cancer. Right, and that's been shown in studies. Yeah. So you need a good diet in order to have a good working immune system. So that's eat, sleep. Sleep is when our immune system actually gets activated. And they've shown in multiple studies that if you don't get enough sleep, your immune system just doesn't function as well. And we all know this, right? It's like when you're really underslept, if you're tired and jet lagged, and you're much more likely to get sick than if you've had a good night's rest.
But isn't that different for different people? Everyone doesn't need 8 hours.
No.
And some people need more than 8 hours.
Some people need more, some people need less.
Right.
But if you're getting some good quality sleep, deep sleep is when your body is regenerating itself. Okay. It's when it's healing, and it's when your immune system starts to get activated.
Right. So if you're tossing and turning and stuff, you're not getting good sleep.
You're not. But I think people who have trouble with sleeping, they get too stressed out about oh, I'm not getting enough sleep. Doesn't help things, right? So I think it's better to shift your mind frame and say, you know what, I'm just laying here, I'm getting deep rest. And just taking that pressure off of yourself that I need to be sleeping, right, sometimes helps you at least relax and get some deep rest and at least get benefits from deep rest. Even
Now, I
if
heard somewhere, I'm not sure where it was, but they were saying once is that there's no way for you to ever catch up on sleep.
Yeah.
They say once you've lost, you're not going to, because I sleep more now, it's going to change me not having slept before. It's keeping a regular system going.
Right.
You can't ever catch up on it. But I have someone close to my family that likes to think that every time I need to get more sleep. Just said you can't. Am I right?
I think the best measure of whether or not you're getting enough sleep is if you're able to wake up feeling refreshed and rested. And it's true, they say you cannot catch up, just because you pull an all-nighter and then the next day you sleep 12 hours. Are you caught up on your sleep? You're not really caught up on your sleep. I think when you're overtired, then you have more of that sleep pressure, so that you tend to sleep later on the weekends or on a day that you don't have to be up first thing in the morning.
All right, how do you help clients stay motivated and commit to these changes over a long term?
So that's always the hard thing, right? Because we all know what we're supposed to do. It's just very hard to get motivated to do it. So I always say baby steps. Every beginning of the year, everybody makes these lists, their New Year's resolutions. I'm gonna lose 20 pounds and I'm gonna eat healthy, I'm gonna go to the gym every day. You make these grand lists and it's impossible to keep those promises to yourself. So it's a lot easier to tackle one thing at a time and choose the thing that's gonna make the biggest impact on your life. Like if you're just constantly tired, you can't focus. And when you can't focus, you don't make the best food choices, right? You gravitate towards those junk foods that give you the quick energy. So if sleep is the number one problem that you see in your life, tackle that one little thing first. And just do the little things that you can do. Don't go to sleep with your phone next to your bed, right? Even if it's off and on Do Not Disturb, subconsciously it's there. So if you wake up in the middle of the night, the temptation is there to start scrolling and to see what messages might have come in. So charge your phone outside of your room. And get an old-fashioned alarm clock if you need it. And wind down like at a certain time at night to say, okay, at 9 o'clock I'm just like no more screens, no more stimulation, and I'm just going to start preparing my body for rest and for bed. So there are a lot of little things that you can do, but pick the one thing from Eat, Sleep, Move, Relax that you feel that will make the biggest impact, the biggest bang for your buck. And then just do like little tiny things. Don't be like, okay, I'm going to get 8 hours of sleep every night. That's not going to work, right? So you just say, okay, well, I am going to draw myself a bath, at 7 p.m. every night. And I'm going to eat early so that my system has time enough to digest and I'm not eating too close to bedtime. Just doing those two things are going to set you up for better sleep.
Let's say you're not living alone. Well, you have the option to just do all these things, or you have kids.
Yeah.
Everyone has a different schedule.
Right.
That takes me into the next question, okay, which is challenges and overcoming them, okay?
Right.
For example, what are the biggest challenges that you face when trying to convince patients to adopt a healthier lifestyle choice?
So, that's the whole thing, right?
That's what I'm saying, yeah.
I'm not here to convince you, right? I am here to support you. You're the one who has to want it.
That's right, giving them agency again, right, there you go.
That's and everybody has individual challenges, for sure. So that's why things like coaching and treating patients too, everything has to be done on a very personalized level. There's no one size fits all. Right. So, for example, if I'm coaching somebody with cancer and they're undergoing certain chemotherapies, a lot of things change, like their taste preferences. I used to love eating this, but now it's like I can't even stand the smell of it. Or just even textures. Not to mention things like nausea and just other gastric distress. So everybody has to be considered what their lifestyle is and what they're able to do. So if a person's short of breath but wants to work up to a certain amount of exercise, it's like you can't just say, okay, starting tomorrow you're going to start doing a 2-kilometer jog. That's not realistic, right? You have to start from where you are, whether it's okay, just every morning at least put your sneakers on and walk around the block. So you take little baby steps, and then you have to set them up for success, because once they don't succeed, then you're like, oh, I'm just like, you're either on the wagon or off the wagon. It's hard to get motivated to get back on once you've experienced failure. So you have to, with baby steps, set them up for success.
Right, and I think you made a good point about who they decide to associate with. All those things are very important, because if they have someone that knocks on this, come on now, let's go. It makes a big difference than if it's easy, if it's just you and you're all alone. Where I think, not instinctively, but I think it's part of the human condition to be lazy.
Yeah.
And to want to put it off until tomorrow. I think that's part of it.
Yeah, I think realizing that, right? And giving yourself a little grace that, like, I'm not really lazy, but as a species, as an animal, right, that we are, our primary drivers is to avoid pain and to conserve your energy and to seek pleasure. So if you think of those three things, right? You want to avoid pain. You want to avoid the pain of maybe going for a 2K run, right? Seek pleasure. It's a lot easier to go for that bag of chips than it is to go out of your way to make a salad and have something that's more healthy for yourself, and to conserve your energy.
Right.
Right? So it is, evolutionarily, you want to conserve your energy so that you might need it later, but we're not really so maybe we are inherently lazy, right? Because it's
That's
more
part of it built into us, right? It's comfortable, and you just get to
it's more
lay
comfortable to just lay there
there.
and sit on the couch.
I saw this documentary where they had the green zones or blue zones where the people live the longest.
Yeah.
And they found out the people that live the longest and the healthiest live first of all, in a hilly area where they're forced to walk many places, but they don't work if they don't need to.
Right.
That was something that was brought out, and I thought that was so fascinating. But they all live a very healthy life, and their life is built around mobility, doing things, and socializing.
Absolutely.
But when they rest, they want to rest. They really sit back and rest, and they don't look at it as something bad, because they have to climb up that hill to get back to their home. So interesting. That is very, very interesting. Let's get into another area. Let's get into some of your personal insights. Okay. How do you incorporate lifestyle medicine principles into your own life?
I am a human being like everybody else, so I'm definitely not perfect, but I do try and be mindful, right? And my own motivations, and this is something that I talk to with my clients, like, what is their primary motivation? What is their big why? Because without that big why, it's hard to have a good motivation, right? So for me, it's like, I want to be healthy, I want a long life, but I don't want just a long life, I want to be active. So I look at my mother who has Alzheimer's. I don't want to spend my last years being
How old
like
is
that.
she now?
She's 85.
Okay. All right.
Yeah.
Did she just recently get Alzheimer's, or she had it for
Maybe the last 3-4 years, it's been getting worse.
So in her 80s, once she got in her 80s then.
Right, right. And so, but now we know there are a number of things that you can do to prolong brain health. A lot of that has to do with exercising and eating well, like a more Mediterranean style diet, and exercising is huge in order to maintain your brain health. The other thing is community, and having somebody to talk to, and having support. So all of these things motivate me to try and live in a certain way so that I can preserve my own brain health, my own physical health. And obviously the motivation is your family. I want to be healthy, to be able to see my kids grow up and hopefully have grandkids someday, and great grandkids maybe. So all of these things are big motivators for me. So how I try and incorporate this is to move my body. I try and establish more of a community. I'm actually more of an introvert than an extrovert, so for me that was kind of hard. And then during COVID, it was really hard because we didn't have that much human interaction. So I actually started a program called Walk with a Doc, right, which I have twice a month. It's not my program, it is an international group that has done this. It's started by a cardiologist in Ohio that was frustrated to just write the prescriptions every day and not see his patients get any better, so he invited some of his patients to go walking with him. So I do this, I invite anybody who's in the community to come and walk with me. So it gives me more of a community, and I get to meet new people and have conversations and have nice human connections while we take a nice long walk.
What's the biggest group you've had?
20 people.
What advice would you give to other healthcare professionals interested in focusing on preventative care through lifestyle medicine?
I think it needs to be 100%. It has to be part of medicine going forward. We can't just keep covering up all of the badness like with medicines. It really has to come from within. And I think it's so difficult because a lot of doctors don't have the time to sit down with their patients and to really find out what's going on in their lives.
You say they don't have the time, or it's just they won't take the time?
It depends.
Because it depends on what they're trying to do. Because having a wife who is a doctor,
Right.
she's complained about how much time she is required to give each person if they come on insurance. I think it's 3 minutes, the most she can spend, or something like that.
Right, it's ridiculous, right?
Wow.
So yeah, that is really tough when you have the constraints that the insurance systems have built around you, which is why in our practice it's non-insurance based, so that we actually can spend an hour with a patient. So yeah, that is a tough one, and it is a big ask. But I think that even regular physicians working for in a hospital or insurance-based practice could partner with people like nutritionists or exercise therapists, and it has to really start to become part of the whole conversation for total body care and total wellness. Our medical model right now is based on illness and not wellness.
You remember our conversation, and that's something one of my spirited debates was about with my wife in the early stages. I said, it's unfortunate you don't realize what you were being taught. And she said, I was taught how to make people live longer. I said, no, you have no control over how long they live. You have control over their quality of life, not quantity.
Right.
However, you were taught to look for the worst in human beings, not the best. And that's where your mind always goes. That's why it's so easy for the pharmaceutical companies, who probably made sure you were taught that, can come in and say, this will help, this is real simple, this is push button. You give them this and it's going to make it better.
Right.
Instead of you finding out what their lifestyle's like.
Yeah, but it's not just the practitioners, right? It's patients. They would rather swallow a pill every day than to have
conditioned
to,
as well, yes.
yeah,
It's in our...
to then, going for, a walk every day.
That's right. It's an easy way out. Do you partner with other people in the healthcare profession?
If somebody needs to be referred for more intense medical or mental health, that there are other people that I can refer to, for sure.
Okay. All right, let's get into the final thoughts. If you could give me one piece of advice to someone looking to improve their health through lifestyle changes, what would it be?
So every single person is different. So I think it starts with your own awareness, like a hard look at your own lifestyle, and looking at what will make the biggest bang for the buck, right? If, that habit of having dessert in a drink glass after, 9 o'clock at night watching Netflix. I'm like, if that is your habit and you feel like just cutting that out will vastly improve your everyday life, start with that, but start with one little thing. Or just like you feel like I'm just spending too much time, sitting. We sit so much. You sit and you drive, or you sit in front of the computer, all day, and you're just not getting enough movement. Just like try, just getting out at least once, during your lunch break, and take a nice long walk while you're on your lunch break, and just make that a habit. And that's just how you live your life.
I've seen it in my own life, and like you said, all of us are we're individuals, and our lifestyle is different, so you have to know what yours is. But I was fortunate enough, I've always pretty much paid attention to mine, and I'm blessed with a genetic system that basically keeps me thin, but I can get larger. I used to eat what I was taught to do, 3 meals a day, and always ending with the dessert. As I got older, I found that I wasn't losing weight, I was gaining weight. And because of a bad knee, or a knee where I've had the meniscus taken out while I was in service, once I'm over 86 kilos, my right knee is painful, and I can't walk the distance. I started eating only 2 meals, well actually drinking my breakfast, and eating lunch, and that's it. Going to sleep early, getting up early, sometimes walking. I shouldn't say I do it all the time, sometimes walking. And it changed everything. I feel better. And recently I stopped drinking, which I enjoyed. I thought, but I said, well, I thought I did. It was just, instead of eating, I said, okay, I'll just drink. And I know it's not good for me, but it feels, I thought it felt, it doesn't feel good, to be honest. Because you wake up sometimes and I don't feel good. So now everything's changed. It seems pretty much, it's normalized. There are no ups and downs, but that's life. I prefer that than to have a headache every now and then.
Yeah, and I think we change too. You know, it's like in our 20s, we could do a lot more things that we can't do now.
Because it's all new, yeah.
Right, and you know, I think you have to pay attention at different, you know, life stages. Like, okay, my body just can't handle that anymore. You know, or this makes me feel good, and this doesn't make me feel good. And it's like knowing yourself.
That's right. And we had the excuse before of not knowing. Because of our technology and social media, there's no excuse anymore for not knowing. You can Google it and find out what you need. Just answering questions. Now with AI, you can even go further and make it really specific to what your needs are, and it will tell you to write out a program for you in a heartbeat. Okay, last question. How can people learn more about your work and get involved in your health and wellness coaching program?
Oh, okay. Well, you know, there's a lot on lifestyle medicine nowadays that is starting to become more popularized, I think. So you can Google that. There's the American College of Lifestyle Medicine that has, you know, a lot of free resources, things that you can do to get started. And if you want like a one-on-one sort of consultation, you know, because everybody's different, I think it's very helpful, at least in the beginning stages, to partner with somebody that is knowledgeable and can sort of point you and steer you in the right direction. I'm at the Tokyo Cancer Clinic, and you know, we see patients, you know, for prevention of cancer and for treatment of cancer, and we try and combine this with our lifestyle as well as our immune cell therapy, which is what we specialize in at the Tokyo Cancer Clinic. So I'm happy to, you know, speak with anybody. They can look us up, Clinic.jp, or I also have my own website, drminako.com, and I'm all over social media, like you said, so they can always find out more, and feel free to reach out.
So you go by Dr. Minako?
I do. I go by Dr. Minako because Dr. Abe is my father. So people in my work, you know, they call him Dr. Abe, they call me Dr. Minako.
Well, I want to thank you, Dr. Minako. Thank you so much.
It's always a pleasure.
I want to thank all of you for watching or listening to this podcast. And never forget, it's all on loan, so continue to reach for the stars.
Because you're too blessed to be stressed.